Kia ora, I'm Ed Gane. I work at the Auckland City Hospital where I'm Deputy Director of the New Zealand Liver Transplant Unit. I'm also a Professor of Medicine at the University of Auckland, and I'm a board member for the Hepatitis Foundation of New Zealand. Today I'm going to talk about a study which has just been published in the New Zealand Medical Journal, and this is entitled Hepatitis B Infection, an Unmet Medical Need 35 years after the introduction of universal vaccination. This work was performed largely by Erin Horsfall, our research fellow, myself, and other members of the Hepatitis Foundation of New Zealand. So in the study, we started off by looking at what we knew was the prevalence of hepatitis B in this country. We have excellent data from the 1998 Ministry of Health Hepatitis B screening program, where almost 200,000 people from high-risk groups, and this is largely Māori, Pacifica, and Asian New Zealanders, adults born before vaccination, were tested for hepatitis B, and we were able to provide robust data on the rates of hepatitis B in these various populations, ranging from around 6% in Māori up to almost 10% in Asians and Pacifica. And then we looked at the 2018 New Zealand population census to get an idea of how these numbers had changed, because the population had increased considerably over the past 20 years, not only from the natural birth rate, but also from high rates of migration to New Zealand of individuals coming from countries with endemic hepatitis B infection. In my role as liver specialist at the New Zealand Liver Transplant Unit, every day I see what happens when hepatitis B is not diagnosed early and the complications are not picked up through adequate follow-up of people living with hepatitis B. Over the last 20 years, we've had over 1,000 New Zealanders develop liver cancer from hepatitis B. The vast majority of people who never had the hepatitis B diagnosed until they developed liver cancer. So they never benefited from the close follow-up provided by the surveillance program from the Hepatitis B Foundation. We've also had almost 200 people require liver transplantation for late diagnosis and treatment of hepatitis B. Now, almost all of those deaths and all of those transplants could have been prevented by better awareness, increased testing, earlier diagnosis, and better linkage to care for all New Zealanders with chronic hepatitis B. Thank you.